So let's look at what treatments were used in medieval times. There were some weird and wonderful treatments that people used, although some of them had a basis of fact. A headache remedy, for example, was to drink warm chamomile tea, lie down on rosemary and lavender-scented pillows for 15 minutes. In other words, have a drink of tea and relax, which would make sense. There were some more random ones, like candles of sheep suet and burn it near the tooth, and cold water under the candle, etc., using worms to dig out the tooth. These were people who didn't know the real cause of infection and disease, just trying things that had been used before over a period of time. But based on the four humours theory of Hippocrates, the preferred way to fight illness and restore those balance in the humours was by bleeding, as you can see here. This was done either by cupping, so collecting the blood, or by using leeches to suck the blood out. Monastery records show some monks were bled up to 8 times in 1 year. Illness was said to be caused by the body creating too much blood, so it is obvious that bleeding a patient, in their opinion, would restore their vitality and bring them back to an equilibrium. Interestingly, leeches are still used today in some hospitals to suck up blood and aid in recovery, so there is an element of positivity in it, but of course you take out the white blood cells that help fight infection. Doctors had 2 other indispensable tools for diagnosing sickness and putting it right. The first of these was the urine chart. Urine was a vital diagnostic tool. The doctor would look carefully at the colour and compare it to a chart like this one you can just see. He might smell it and in some circumstances even taste it to help him decide what was wrong with the patient. Again, many patients today still submit urine samples as part of the process of diagnosis, so it doesn't mean that medieval doctors were way off the mark. They didn't necessarily know what to do next, but they did use bodily fluids as one way of finding out what was wrong with the patient. The other important chart was one like this, which is a zodiac chart. No self-respecting doctor would treat a patient without this tool. Charts like this would tell a doctor which parts of the body were linked to which astrological sign and thus dictate what the physician might do to cure a patient. For example, some things might work for an Aries, but not for a Pisces. The chart might also tell the physician the best time to carry out the treatment and even when to pick the herbs used in medicines. Herbs picked at the wrong time of the moon cycle, for example, might do more harm than good. It was a complicated business for doctors to decide what was causing an illness and how it must be treated, but as you can see here, there is a link and a crossover between the scientific approach and the supernatural.